So what we're going to talk about now is we look at like programming or goal setting. And the first thing we want to ask is, why do we even care about flexibility? Why is it something that we should be doing anyways? And this gets us into the question of what are the benefits? And just as there's no single type of stretching, there is no single type of weight training exercise, but you wouldn't say, hey, what's the benefit of weight training or doing that exercise? It's not the exercise that makes the difference. It's the results you're getting, the adaptations. And so if we look at the benefits of stretching, like why do people bother to do it? Like what are they hoping to do? They say to increase range of motion, right? But to do what? What is that range of motion going to do for you, right? Okay, great. You can now touch your toes. What does that mean, right? Or great, you can do the splits. Well, now it's just a circus or parlor trick. And usually people have this impression that if you are more flexible, you're going to have a decrease in injury, right? That would be the main reason why most people stretch, right? They do it as a warm-up or a preventative aspect. Sometimes people will do it to increase performance, right? They'll say, hey, I want to increase my speed or my strength or my force or my sport. And some people just says it feels good, right? So these are your, if you ask 50 different people, you're going to get 25 people that say stretching sucks, right? I don't like it. It feels uncomfortable. And then other 25 people, oh, it feels so good, right? And again, what kind of stretching are you doing? Active dynamic, active static, and so forth. But here's what's interesting is that the evidence for flexibility is interesting. It's based on anecdotal, so based on how people say or think, but not necessarily on scientific evidence. What's interesting is about 20 years ago, there was some studies that actually started to be done, and what the results they started to find was not what they had thought. And in 2004, Thacker and associates came up with a huge meta-analysis, and they basically said there's not sufficient evidence to endorse or discontinue routine stretching before or after exercise to prevent injury among competitive or recreational athletes. So basically what they found was people that were stretching and people that weren't stretching got injured just as much, right? So it didn't say anything. It just showed that it's not doing what we thought it was going to do. When you do a review of the literature, you find mixed reviews. You find some things that say, yeah, it's good, do it. And then you find other things that say, it might not be worth it. Nothing will come out and say, hey, it's just bad, but a lot of it's coming out as inconclusive. And no one really wants to buck that boat. But if you just do a quick like Google search on like benefits of stretching, you'll find a lot of like blog posts and different experts or so-called specialists out there, influencers that are saying stretching sucks. And you got other people who are saying, no, stretching is great. My question is why is there so much confusion? And when I had my students do a research project in KN 200, and some of you already did this, you found that some of these things, stretching before workout does not appear to decrease the occurrence of injury. It seems like the warm-up, not stretching, seems to be the most important deterrent. Greater flexibility may impair performance, right? So you may have a decrease in injury, but the research 20 years ago started saying that it wasn't that big of an aspect. But actually that the more flexible you are, the less performance or less muscle strength you may have. And one of the main reasons why there's so much disagreement is what was the goal, right? Are you after injury prevention, right? Are you doing stretching to prevent injury? Are you doing it for performance? Are you doing it just because of range of motion? Let's say you're post-op surgery, or you're a kicker or a dancer and you need that range of motion. So the type of your outcomes for someone that's trying to prevent injury is going to be different than for performance. And as we said, there's 4 general different types of stretching. Some might be different for different aspects. The biggest aspect is what type of stretching was performed in these studies, right? So were they looking at the concept of injury prevention and performance, and were they looking at passive static, or active dynamic? And the last thing is, what was the population? Right? Are these PTs working with post-op geriatric patients, or are these athletic trainers working with injured athletes, or are these personal trainers working with the general population? And what you do in one setting is not going to transfer over to another setting. And that's what happens quite a bit with get the sport of bodybuilding infiltrating fitness. You get physical therapy working with surgical patients, and then the restrictions they put on their surgical patients then get carried over to the general population, and that might not be true, right? Like, oh, sit-ups are bad for the back. Well, sit-ups are only bad for the back if you just had back surgery, right? But if you're a normal person, not so much. When we look at the common indicator for why we would want to stretch in the first place is we're looking at tightness, right? And tightness is sometimes good, sometimes bad. I don't know, like people usually refer to it as bad. And that's the question I want to ask. Is tightness good or is tightness bad? And most time people say tightness is bad. Tightness may be a good thing. And when we look here, when we look at the kinetic chain, muscle tightness or movement is a product of the muscle, maybe, right? It could be a tissue issue of not having enough length, but it can also be, if we're looking at software, it can be a motor control issue. So if you look at musculature and you look here, is that the only way the muscle can do its job, which is generate tension in the first place, is if the nervous system tells it to contract. Tightness in the muscle is muscle tension. Muscle tension is muscle contraction. Muscle contraction is a product of the nervous system saying go. So if muscle contraction is 100% driven by the nervous system, tightness, what we saw here in this slide here, is the muscular system doing the only thing it knows how to do, and it's doing so by the nervous systems. And again, when we look here and we analyze, the reason why she can't go further into trunk and hip flexion is because she's got tightness in the posterior chain here, right? So she's trying to go in this direction, but she's got tightness here in the erectors and in the hamstrings. When we look here, the agonist-antagonist relationship here is that the trunk flexors and hip flexors are trying to go further into trunk flexion. And the reason why she can't go any further is because her trunk extensors and hamstrings won't let her, right? It's probably not because they're at the muscular limit. It's probably not at the joint, because we know that we could do this, right? Especially if we did like a single leg, we can assess that. So what's really keeping her from going forward is the nervous system saying no, right? This is putting brakes for, so whatever reason, the body's not strong enough or comfortable enough going there. Same thing we look at here. We look at the active hip flexion here. So she's bringing her leg up into hip flexions. The hip flexors are doing the work. So this is an active range of motion. What's actually happening is she's getting the go signal sent to the musculature, as because this is the agonist, this is the antagonist. So it's getting the stop signal from that, right? So go signal, stop signal. Now, if I go further here and I do passive range of motion and I pull further into that position, that's the go, right? That was the original go signal. And this was the stop, right? There was no muscle contraction going there. But as I pull further into this position, there's going to get to a point where I can't go. And I could hit the articular limit where I've hit the joint capsule. But what usually happens is that the roles flip. And now the agonist becomes the antagonist, and the what you're trying to stretch actually is the agonist, and you're actually now doing a tug of war. Your brain saying, "Hey, I'm going to go this direction," as you try to pull in this direction. So you're working upstream against your nervous system, not working with your nervous system is the resistance. You're not trying to lengthen this muscle. You're trying to get the nervous system to stop contracting it. Again, the muscular system cannot contract unless the nervous system tells it to do so. And in fact, that's the muscle's only job, is muscle tension. Think about this situation. It's going to get cold here soon, and we're going to have snow on the ground, and people are going to be walking on ice. And think about what happens when you hit ice unexpectedly, right? You're walking along, and all of a sudden you hit this patch of ice. Think about what happens to your movement. And you hit that patch of ice and you don't fall on your butt. You tighten up, you restrict up, and you start taking these small little baby steps to limit your risk of injury or falling. And then right when you hit pavement again, or a non-slippery surface, your range of motion restores. So again, perhaps tightness is a protective mechanism. It's restricting movement to prevent the body from achieving vulnerable positions, and it may be the best thing for you right there. My argument is that tightness is not a good or bad. It's a red flag saying there's something going on, but the last thing we want to do is saying, "Hey, brain, you're stupid. Let's just force this range of motion," right? Just as a side note, if you do want to walk on ice, you need to walk forward. So if you fall, you don't slip feet from underneath you, that you can fall forward and you can at least put your hand out, but make sure you don't fracture your wrist. So again, this is what we're looking at when we're looking at the human movement system, and all of these things are in play. And so when we think of tightness, we want to start thinking as tightness as the brain and knows how to protect itself, right? The flight or flight mechanism is going to come in for certain things. it's also going to control the amount of range of motion that we have. And when we look at analyze this pyramid here, we have, again, those neuromuscular resources, and we have that passive structure. And we're looking at mobility. And the relationship of those neuromuscular resources with the passive structure, and postures included in this, is stability. And when you have increased stability, right, like dry, solid pavement, you're going to have increased mobility. And if you have decreased stability, like ice, because you're on an unstable surface, your body's going to limit mobility. And so we always want to, when we're looking at trying to change range of motion, what are we doing for the stability of the system? And the more stable the system is, the more range of motion it's going to give me. The opposite of this, however, is not true. Just because I increase mobility doesn't necessarily mean I increase stability. And in fact, if I increase mobility, right, let's say I loosen the bolts a little bit, that doesn't necessarily mean that I'm going to be more stable. I actually might be more unstable. Think of this when we look at what are you doing to change range of motion. Stability over mobility is the key. Again, increasing joint mobility is not a problem, but you never want to compromise joint stability. You want to increase joint stability, and the byproduct of that will lead to joint mobility, but you never want to really increase joint mobility and destabilize the joint. So you don't want to stretch out a joint capsule or connective tissue and not have the muscular or motor control software to do that. Quality of the movement is more important than the quantity. And we get into this active range versus passive range, which is another way of looking at quality versus quantity of the range of motion. So if we look at this situation here, you have active range of motion, then you have passive range. Passive range of motion is always greater than active range of motion. You're always going to have at least maybe 5 degrees more passive range of motion, up to 10. And you can see here in this position, you have the client on the table. He's doing about 90 degrees of hip flexion, and this was active range of motion. And then the partner comes in and pushes, and he can squeeze out another 5 or 6 degrees. So this is a nice balanced situation. Again, you have the hardware and software issues that are at play here. And when you look at the active range of motion, as we talked about earlier, when I'm trying to go into hip flexion, my hip flexors are the agonist and my hip extensors are the antagonist. And at some point, usually in active range of motion, you can't go any further. It's usually because of the maybe active insufficiency of the hip flexors. But remember, as you're shortening the hip flexors, you're lengthening the hip extensors. So as you're going actively insufficient on one side, passive insufficiencies happen on the other side. If there's an actual tissue issue, then the passive insufficiency is going to be the problem. But typically it's software issues, it's motor control, it's strength. It's going to be the active insufficiency that's keeping you from going there. But in this case, when I'm doing passive, I'm getting the go signal here because the agonists are doing the work. But once my partner comes in and pushes, now the reason why I can't go any further is not because of weakness or instability, it's because of the muscle I'm fighting, the nervous system going forward. Just again, as a little reminder, I added this slide here just to show that you can see the nerve tension there, that you can see that maybe the limitation of range of motion isn't the musculature at all, but the actual like bulge on that disc because that nerve's being stretched. So go ahead and just stretch it a little bit more to put some more pressure on there. Again, this slide, it's like the 6th time or 7th time it's popped up. The goals for increasing range of motion are a product of not just the hardware, the actual tissue, but the communication there as well. And this is where we get this, are you working with the nervous system or working against the nervous system? This go versus stop. Now, when you talk about the nervous system, go is referring to facilitation and stop is inhibition. So the switch is either on or off. And I may have lied to you in previous lectures where it's not so much the stop go where it's fully on or off, but it's more like a dimmer switch, right? Like you're facilitated where you're like go where it's kind of light. But when we're looking at optimal performance, we want that dimmer switch to be either on or fully off. Now, if we're looking at flexibility, range of motion, what we're normally looking at is inhibition. So we're looking at stop signals. And you got different types of inhibition. But basically what it is, it's like a dampening aspect between the go signal there. And so you have your agonist, your alpha motor neuron coming in, and your inhibition are more like these governors or dampening switches. And it kind of looks like this is I get my go signal here down the motor and I get some sensory feedback, and this is all part of that software mechanism of how this is contracting. You can kind of see that this is part of a reflex lip where I have like a stimulus, some like either a hot pan or a sharp object. And these software aspects are so well wired that they happen as reflex, where I don't need to get the go signal from the brain. It's going to come down anyways, right? Same thing with the stretch reflex, where it's kind of protective mechanism. And all of this is showing this concept of reciprocal inhibition. As one muscle's contracting, the opposite side's relaxing. So as I'm going down and I'm pushing against the floor, I'm getting go signal against my abdominals to push. Like let's say there's a ball there and I'm pushing down, and it's telling my erector spinae to relax. I'm trying to go in one direction versus the opposite. And so this stuff is hardwired into the body in terms of, as one muscle's contracting, the other one's relaxing. As one muscle's contracting, the other is relaxing. So the question I have is, when you're trying to change range of motion with yourself of your client, are you working against your nervous system or working with your nervous system? Are you working for trying to improve the software? Or are you trying to change the hardware, right? And your goals are both, right? This is typically looked at as motor control, right? The signaling, the stop and go signal, or the tissue extensibility is an actual hardware aspect. Does this tissue have some length issues? And post-surgery, it could be, as we talked about in the previous, the sarcomere repartitioning, right? Are you in a chronically shortened position and you had some issue? And both approaches are going to be part of your change when you try to make those changes. Keep in mind that this is where you're trying to get, right? You're trying to get this ideal muscle balance between agonist, antagonist, or left and right, front of the axis, back set, whatever you're looking at. This is what you think is happening sometimes, where it can be a motor control or tissue issue, right? Where you have a chronically shortened position, lengthened position, weakened or inhibited. The other aspect is you could have perfect muscle balance, but you're not centered in the joint. So now you have an articular issue, like some kind of postural distortion or something going on. So both of these will present the same way. They're going to respond totally different. And the type of stretching or intervention you need to do for this is different than the type of mobility work or intervention you're going to do for that, and vice versa. So that's why it's important to understand what the problem is, what the goal is, and then understanding your tools to try to achieve that.